Many men consider receiving oral sex to be the safest sexual activity. After all, there is no penetration, no ejaculation into a partner, and usually no concern about pregnancy. However, this perception of safety can foster complacency about sexually transmitted infections, STIs. Biology does not abide by cultural assumptions. Microorganisms do not recognize the difference between safe and risky acts. Understanding the real risks associated with receiving oral sex empowers you to make informed choices that protect your health without sacrificing intimacy. Why oral sex can transmit infections. The mouth is a complex ecosystem populated by billions of bacteria, viruses, and fungi. We call this the oral flora, and in its natural environment, it remains in balance. The urethra, the tube inside the penis, is typically sterile and has a very different microbial landscape. When a partner's mouth comes into contact with your genitals, it introduces microorganisms into a space where they can flourish unchecked. Even when both partners feel healthy, asymptomatic infections can reside in the oral cavity. Some pathogens that cause no symptoms in the throat can produce noticeable illness in genital tissue. Infections you can contract from receiving oral sex. Human papillomavirus, HPV. HPV is the most common STI worldwide. Many people associate it with genital-to-genital contact, but oral HPV infections are increasingly recognized. An infected partner can transmit the virus to your penis during oral sex, leading to genital warts or, in rare cases, penile cancer. High-risk HPV strains are also linked to cancers of the throat and mouth, which underscores the bidirectional nature of transmission. HPV vaccination is available for men up to age 45. Talk to your healthcare provider about whether you should be vaccinated. Candidiasis, thrush. Candidiasis is a fungal infection caused by overgrowth of the fungus Candida albicans. An overgrowth in the mouth manifests as white patches or thrush. During oral sex, fungal spores can transfer to the glands or foreskin, causing balanitis, a painful inflammation characterized by redness, itching, and a clumpy discharge. Men who are uncircumcised or have diabetes are more susceptible. Herpes simplex virus type 1, HSV1. Cold sores, fever blisters, around the lips are caused by HSV1. Active blisters are highly contagious. If your partner has an active cold sore and performs oral sex, the virus can infect your genital area, causing genital herpes. Although genital herpes is more commonly associated with HSV2, HSV1 genital infections are increasing due to oral genital contact. Genital herpes causes painful sores, and while antiviral medications can reduce outbreaks, the virus remains lifelong. Syphilis. Syphilis, an ancient STI that has resurged in recent years, begins with a painless sore called a chancre at the site of infection. Sores in the mouth or throat may resemble canker sores and go unnoticed. If such a lesion comes into contact with your genitals, syphilis bacteria can enter your bloodstream. Untreated syphilis progresses through stages and can cause serious long-term health problems, including neurological damage. It is easily treated with antibiotics when caught early. Gonorrhea and chlamydia. These well-known bacterial infections can inhabit the throat without causing sore throats or other symptoms. When a partner performs oral sex, bacteria can transfer to your urethra, causing urethritis, characterized by burning during urination and abnormal discharge. Without treatment, these infections can lead to prostatitis, epididymitis, and infertility. Because throat infections are often asymptomatic, people may unknowingly carry and transmit these bacteria. Protecting yourself. Use barriers. The most effective way to prevent transmission of oral flora and STIs during oral sex is to use a condom. Flavored and ultra-thin condoms exist specifically for oral sex. They provide a physical barrier without significantly diminishing sensation. If condoms are not appealing, consider other forms of barrier protection, such as a cut-open condom or a dental dam. Communicate and test. Open dialogue with partners about sexual history and testing is essential. Both partners should undergo regular STI screening, especially when engaging with new partners. Many STIs, including HPV and chlamydia, can be present without symptoms. If your partner has a cold sore or throat infection, abstain from sexual contact until it has cleared. Practice good hygiene. Encourage partners to maintain oral health through regular brushing, flossing, and dental checkups. While this does not eliminate risk, a healthy oral cavity may reduce the bacterial load transferred during oral sex. Get vaccinated. Vaccines exist for HPV and hepatitis A and B. Vaccination reduces your risk of developing cancers and liver disease associated with these viruses. Discuss vaccination with your healthcare provider, particularly if you are sexually active with multiple partners. Broader sexual health considerations. Understanding the risks of receiving oral sex highlights the importance of comprehensive sexual education. No sexual act is completely risk-free, but knowledge allows you to manage those risks effectively. Maintaining overall health through good nutrition, regular exercise, and adequate sleep supports your immune system and reduces susceptibility to infection. Avoid smoking and limit alcohol. Both impair the body's ability to fight off infections and heal tissues. When to seek medical attention. If you experience burning during urination, unusual discharge, sores, warts, or persistent itching, consult a healthcare professional promptly. Many STIs are easily treated when diagnosed early. Left untreated, they can cause long-term health issues and be passed to others. Regular checkups with a urologist or sexual health clinic can ensure you stay informed about your status. In conclusion, receiving oral sex is a pleasurable experience that carries real but manageable health risks. Pathogens such as HPV, Candida, HSV-1, syphilis, gonorrhea, and chlamydia can be transmitted from a partner's mouth to your urethra. Prevention strategies: using barriers, communicating openly, testing regularly, practicing good oral hygiene, and staying up to date with vaccinations greatly reduce the risk of infection. By dispelling myths and embracing factual information, you can enjoy intimacy while prioritizing your long-term health. Sexual well-being involves informed decisions, honest communication, and proactive healthcare. Taking these steps will not only protect you, but also create a safer environment for your partners.